My name is Allie Luttrell, and this presentation is on Striking Out Strokes, a secondary prevention plan for older adults. This is being given at Jacksonville State University for Clinical Prevention and Population Health, NU712. The objectives of this presentation are to discuss the older adult population and their risk factors for strokes. The primary, secondary, and tertiary levels of prevention will be discussed. Striking Out Strokes is a prevention plan that will be implemented by the DNP prepared nurse, and we will discuss the roles of the DNP as well as the interdisciplinary team. A minimum of 2 competencies that the DNP prepared nurse must exhibit to properly implement this plan will be explored and described. The measurements of success of striking out strokes will also be discussed, and we will analyze the outcomes. For this presentation, the term older adults refers to adults ages 65 and above. This group is often considered a vulnerable population. What makes this group vulnerable is not necessarily their age alone, but is also involving their health, their living situation, their financial situation, their family support, and their social status. So there are many factors that play a role into what makes them vulnerable. The population of older adults, according to the 2020 U.S. Census Bureau, was 16.8% of the U.S. population. According to Medline Plus, a stroke occurs when there's a loss of blood flow to an area of the brain. This can be an ischemic stroke or a hemorrhagic stroke, which are the 2 types of strokes that we most commonly see. If the brain cannot get proper blood flow, then brain cells that are lacking that blood flow don't get enough oxygen. When these brain cells don't get enough oxygen, they can die, and this can cause long-term damage. If the oxygen is only lacking for a short period of time, then the cells have the possibility to repair themselves, and the damage can be reversible. Symptoms of a stroke include facial drooping, arm weakness, speech difficulty, or slurring. This is often described in the acronym of FAST to help people remember it and to make sure that everyone realizes the importance of time. If these symptoms are recognized, then it is immediately time to call 911. Facial drooping can be assessed by having a person smile and assessing whether one side of their face is drooping more so than another. Arm weakness can be assessed by having someone hold their arms out, and if one side has a drift or falls involuntarily, then that's cause for concern. This can also be assessed in the legs. If someone is laying down, you want to see if they can hold both their legs up. And difficulty in speech can refer to slurring of words or often confusion or not being able to think of the right word that they're trying to say. Other symptoms could be a headache, trouble seeing, trouble walking, or numbness. Risk factors for stroke are oftentimes modifiable. Some modifiable risk factors include hypertension, diabetes, hyperlipidemia. Other lifestyle changes included in these modifiable risk factors are smoking, obesity, diet and nutrition, or physical inactivity. It is important at a young age to implement good, healthy lifestyle choices and practices into your life, and it will decrease your risk factors for stroke or many other diseases as you get older. The American Stroke Association came out with a stroke risk assessment that we're going to use in our Striking Out Strokes intervention plan. This stroke risk assessment basically is a yes or no checkbox questions for several questions determining if you are higher risk or lower risk for a stroke. How do strokes affect the older population specifically? Approximately 3/4 of all strokes occur in adults ages 65 and above. It affects them a little differently because it can reduce mobility more significantly in these patients. More than half of stroke survivors experience reduced mobility, and stroke is the leading cause of serious long-term disability. A lot of patients, in order to recover from a stroke, need pretty extensive rehabilitation. The map on the left is showing the standardized death rates in Alabama between 2018 and 2020 for adults ages 65 and above. And the map on the right is showing standardized death rates for ages 45 to 64. So this just kind of shows the numbers show a significant difference in the amount of strokes that occur in these populations. You can tell they're much more frequent with much higher mortality rates in the adult population of 65 and older. The levels of prevention include primary, secondary, and tertiary. Primary prevention refers to trying to prevent a disease process before it starts. It would be healthy eating, exercise, and it's just general health promotion. Secondary prevention refers to early detection and treatment of a disease as soon as it is detected. This detection must occur early on. This can be screening programs. That's what this particular presentation, Striking Out Strokes, is a secondary prevention. Tertiary prevention is focused on the middle or late stages of the disease and tries to prevent the disease from continuing or preventing further disability. Striking Out Strokes is DNP-led. It is very community-focused. It would take place in a local community center, and it is aimed at preventing recurring strokes in the older adult population. It is a semi-annual check-in for community members that would be promoted by local primary care providers and others around the community, to where adults 65 and older who have had a stroke in the past can be referred for every 6-month check-in to have a few things assessed to figure out where their risk is of developing another stroke. It is also open to those who haven't had a stroke before if they feel led to be there as well. It is very important to just make members aware of the stroke signs and symptoms and how to react. Steps of striking out strokes. When these patients initially come in, they will have their vital signs obtained. We are monitoring for hypertension, as hypertension is a very significant risk factor for stroke. They will have EKGs if they're indicated, such as if a patient has a history of atrial fibrillation or has been having signs and symptoms of atrial fibrillation that need a little further evaluation. The primary care provider will be there for the town, just one primary care provider. So if they find that it is indicated, that will be performed. Medication reconciliation will be performed. Many patients that have atrial fibrillation or have a history of a stroke will be on anticoagulation medications. So we will be assessing to make sure that these patients are taking their medications properly and obtaining them from the pharmacy. Physicians will collaborate to be sure that follow-up appointments are scheduled as needed with these patients, and that each patient before they leave will take the stroke risk screening from the American Stroke Association. That was a few slides back, and will determine their stroke risk scores. They're taking this every 6 months to make sure their risk score is not increasing. The Striking Out Strokes intervention is mostly aimed at adults 65 and older. However, adults younger than 65 are also vulnerable to stroke. So if there is a patient with a history of stroke who is younger, they are able to attend if that's something their primary care provider has recommended for them. It is specifically aimed at those who have had a stroke or a TIA in the past, as their risk is increased of having another. The intervention specifically will be promoted by primary care providers at the local primary doctors. They will pass out flyers. They can refer their patients, inform them about it. Local pharmacies can do the same thing just to get the word out and encourage people to go. When stroke patients are discharged from the local hospital, they can also be referred to this program Not only does it help them get education and prevent strokes from recurring, but it also can help them get to know other people in the area who are going through the same things that they are. After the striking out strokes intervention, the following interventions will be patient specific. There will be referrals to primary care providers for patients that don't have one, as there will be a primary care provider at the striking out strokes. There will be referrals to specialist aid for those that need a cardiologist or a neurologist, and you can schedule follow-up appointments as well. One of the main focuses of this is to build rapport and trust between the community and the healthcare providers within that community. The interdisciplinary team composes of the DNP, nurses, a cardiologist, neurologist, primary care physician, and pharmacist. Pharmacists will play a big role in making sure patients are on the medications they need to, and they can monitor medication adherence very closely if that patient uses their pharmacy. The DNP specifically has a role to lead. They want to be a leader, inform other members of the interdisciplinary team of the importance of this intervention and how it's going to be done, to organize the intervention so that it is done on time, it is done properly, and to build relationships between the interdisciplinary team members, but also those in the community that come. Outcomes will be analyzed at the end, and the DNP will head that up as well. The goals overall are to reduce the occurrence and reoccurrence of strokes, to raise awareness, and after a year of implementation, the overall goal would be for there to be at least 25% rate in stroke reduction. Analyzing the outcomes, we would want to monitor the occurrence of strokes in the area. We would separate these by age group to determine what occurs in greater than 65, and then monitor the outcomes of hospitalizations if there are any in that area. Evaluation forms will be filled out after each session so that patients can evaluate the intervention. This is a secondary prevention method, as each of these things taking place are screening and assessing the risk. The impact of secondary stroke prevention is extremely important because it is important to recognize strokes early. Strokes lead to more strokes. So if a patient has had one in the past, it is important for them to be following up regularly in order to prevent them from having more in the future. And that is the purpose of this intervention. Leadership competencies important for the DNP to inhabit include adaptability. They need to be able to be flexible because things don't always go as planned, but they're going to initiate this process. They need to be very self-motivated. Systems thinking, this is a system and it should flow as one, so it is important for them to be able to organize that fully and then to manage the project and set priorities for different patients and different members of the interdisciplinary team as a whole. Leaders in general, so each member of the interdisciplinary team should be able to build relationships, to communicate effectively, and to make decisions in a timely manner. And overall, strokes have had a major impact on the older adult population, so this would be a hope to minimize those in the local community. The event is very focused on secondary interventions, but any education, especially asked for by the community members, could be given as well. It is important to improve outcomes in stroke patients and decrease stroke occurrence, and it is really important for the interdisciplinary team members to remember they're all working toward the same goal. The DNP must manage their time well, communicate effectively, and take care of their interdisciplinary team as well as their community as a whole. There are a few slides of references here if anyone wants to look back at the websites that I used and gathered my information from. And other than that, that is all I have.